working for about 25 years here in the Willamette Valley, and I've worked in a lot of other states, but this is home. This is where I raised my family, and I'm down here volunteering because I believe in what the occupiers believe in. You can just see with this one small interaction our homeless youth. We have a huge amount of homeless who do not get connected, and they drop out. You can tell, you can just do your own screening. You can see their teeth are falling out, they don't hear well, they don't process quick. They're not youth who are able to fulfill their development at all. You know, I mean, they're like gypsies. I mean, they're on survival mode, and we can do so much better. And I was your age in the 1970s, so I thought we kind of got some of this stuff cleared up then. And to see it now, and I'm an older mom, so to see it now while I'm raising kids, and to see that we are so far from even providing the most decent education to them, healthcare. I mean, you can tell. Look, I mean, just do your own screening. You know, you can do a screening on YouTube. Open your mouth. When you screen somebody, can I open your mouth? So why would you want to go out and do anything to help with the homeless? The homeless start at age 12 here. Believe me, they absolutely do. They're leaving abusive situations. They're leaving homes where their family has been foreclosed on, that they're living with 5 other people, levels of the family, in an apartment. It is all around us. It's the haves and the have-nots. And until you come down and you look and you ask and you see, no one's getting it. No one's seeing it. So to me, it's a way of just supporting the people who are out here saying, be aware, be awake now, please. You know, this is our democracy. We're letting it go down the tubes pretty quickly. That's sort of my philosophical approach, and so that's what I'm doing down here. I like to not use my regular name, my legal name, other than, you know, if I'm needing to do something medical because of my nursing license, but I like to keep my anonymity here. I mean, this place is very porous, and in that term, what I'm referring to is all the different people in and out here. And also, this is a social movement of magnificent proportion. You know, maybe it doesn't make the Statesman Journal every day. That's okay. You know, so what? I can feel it, I can see it, I can notice it. It's an awareness, it's a wake up, and yeah, I want to be anonymous as I can. I want to protect my children. You know, we live in a wealthy area. I'm very fortunate. They've gotten a very good education here. Nothing wrong with the teachers or anything. It's the systematic way of not delivering the services that we're paying for, you know, and why there is an oversight for that. So yeah, that's why I remain anonymous. You know, I don't know if that helps with your question, but I'm going to walk toward my point. Yeah, so when I come down, the first couple days, what I did was observe. That's nursing science. You observe and you assess. So in nursing theory, you have the idea that the patient can either be one person, one single person, like me observing you, or me observing a small group, or me observing a large group, a larger group, or our group of population, and screening for what the needs are. So individually, people are probably familiar with that with the nurse, you know. Is the person breathing okay? Are they eating okay? Are they in pain? Those sort of things. But as a community health nurse, what you're doing is you're looking at how people are getting access to the most basic and fundamental needs that sustain their health. Their health as a group is important because it affects the bigger pond being the bigger community we all live in, where the haves and the have-nots do meet up in Walmart and at the library or whatever. And so anything that can be helpful to support the larger group is first of all done through an assessment. So one of the things I did on the first couple times is just walk through and see what's going on, talk to the people who have been running the medic tent. The medic tent has been well staffed. There's a medic there who's done 5 tours. It's just been back from the war now. And then we have an EMT, so they certainly know how to do the individual screening, and generally it's mouth and foot problems right now. And people all think, well, so that's not such a big deal, but in nursing science, you look at what affects a person's body that breaks down their defenses. Well, skin, that's our largest organ, so that protects our body. So if you have anything in through the mouth or through the foot that is breaking down that barrier, then that's something you want to be right on top of, and it can be very preventative. So nursing science is about prevention, and so being down here, I see my role as anything I can do to interact to be preventative for the whole group in just looking at it as a system. So that means I not only talk to the medic and the EMT and the medic tent and the medical tent, I also go over and look at sanitation, look at how people are working with food. Do they grab with open hands, out of the food dish, or are they ladling food out into a bowl? Those are very small, specific things that can be broken down into a checklist that have to do with, are you keeping down the spread of virus and bacteria? It sounds kind of like minutia, very minute detail. It is, but it's prevention. So what? It works, and that's what I see my job is. So that's what I've been doing, is kind of like an assessment and then a reassessment. Number one. Number two is when I talk to the people here about what they want, what they need, from the medical people and from my screening, it's a lot of what I would call health literacy. They want to know how to take care of themselves because they are homeless or about to be homeless. That's about the most common. I just got sick. Are you okay?
Yeah.
Oh, yeah. That's about the most common. That's the most common concern, is that they're so stressed, they're up at night, they can't shut off. They're kind of like soldiers, but soldiers for a cause, and they can't turn off their stresses that they don't have a home, or their home's going to be foreclosed. They have children. What are they going to do with their children if they get foreclosed on? They don't want to go live in the woods. We're going to be moving into the winter months, and there really is not a catchment. There's not a catch area for this. There's some social services that work very well, as much as they're funded and as much as they can do that. But this is one little niche that kind of adds to that I think is important. So you've seen, I've talked to, some pretty young people all the way up, and just trying to get a sense of what their needs are. And it's shelter. So it's something that has to do with their environment. Is their environment able to support them to stay healthy? So that means dry. Can they get around and communicate with people so that they can communicate their needs? So you probably saw that those young people approach me pretty hesitantly a couple times. They've never met me before, but you have to develop a relationship with them so that they can trust you to come back and ask them what's really of concern to them. Because if you don't, then you're missing a big piece of how you can help them. And a lot of times the help I do is, it's just because I happen to know some information. It's not because I'm laying hands on them. I'm not pulling out a stethoscope. I'm not opening them, having them open their mouth and look at the back of their tonsils. I can give them information to help them learn how to take care of themselves. So it's promoting the self-care, and that goes from this age all the way up. So again, mouth and feet. The people who have approached me here, their teeth are all falling out. It's like, okay, so you know what? You're going to have to think about rinsing your mouth out with soda water twice a day. You got to keep the infection down. They're not going to be people who can afford to go out and get an antibiotic or something for their abscesses or anything, and they're walking around kind of in constant pain too. Yeah, but this is America. This is America.